first exercises we want to talk about in developing a strong core is what we call the non-tripod exercise. Basically, whenever we have a tendency to move our pelvis, we're going to have a tendency to try to make a tripod, or 3 points, to make 3 points of balance. So traditionally, when I ask somebody to lift a leg up, they're going to push down on the other leg. So if I was to ask this person here to pick this leg up, just bring this up to 90 degrees, they're going to have a tendency to push down on this opposite leg to make a tripod between this foot and the 2 points of their pelvis. Well, that's great for balance. Unfortunately, it pulls a lot of the ab out of the equation. So what we want to do is teach the person how to use the abs to stabilize. And the primary muscle we're going to use to stabilize here is going to be the external oblique as well as a small amount of internal oblique. Because I believe it's so important for athletes to actually understand and be able to know which muscles they're working, we're going to ask our subject to actually palpate the muscles in this particular area. If you remember before, when he was doing a crunch exercise, I was able to actually push right into the area of the oblique. And he looks like he's a pretty strong guy, and he's just not firing those muscles appropriately. This exercise is designed specifically to help to fire those muscles. So we're going to set the person up. They're going to be in a supine posture. We're going to try to keep their pelvis in a relatively neutral position. I like to keep the legs bent at 90 degrees, but that's certainly not a requirement. You can have it at slightly less or slightly more than that. Consistency is going to be important for the exercise. Going to have the subject actually come right off the iliac crest into the soft part and palpate here with either their fingers or their thumbs. Can I have you do that? First thing I'm going to have them do is brace. Remember, we don't want to hollow from our discussion before. We just want to brace. So he's going to brace the abdomen in this area here slightly. We're talking about 20% contraction or so. Next thing we're going to do is we're going to have them lift the leg off the ground slightly. So they're just going to bring the leg no more than 1 inch off the ground and hold it there, maintaining a 90-degree angle. Now what they're going to do is they're going to pick the opposite leg up, bringing the thigh to a 90-degree angle, to this position. And as soon as you do that, the oblique has a tendency to kick in right in this area here. I'm going to bring this back down, back up, and back down. As the athlete's able to maintain bracing, maintain a neutral posture in the pelvis, and be able to perform this exercise and feel the oblique contract, and as an individual training this athlete, you should be palpating that muscle, making sure they're contracting it. And not only should they be firing the one on this side, but it should be on the opposite side as well. And if they can fire one side better than the other, then they're not ready to progress to the next portion in the sequence. If we can't make a stable base here, there's no reason to superimpose other forces onto that area. Otherwise, we're just asking for problems down the road. So the next portion of the sequence, once the athlete can do this, and generally you can do any number of reps. We would do more reps, okay, if we were looking more for endurance sort of activity over a longer period of time. We haven't noticed a significant difference in our office, at least in a rehab setting, from giving the patient more than 10 or 15 reps to do at a time. We get much better results if we give them multiple sets. Again, this is to lead them into being able to perform something in their normal activities or their sporting activity. Chances are they're not in the Olympics for sit-ups or something like that. So the second part of the exercise, we're going to have them brace. They're monitoring here. One leg's going to come up slightly. Now as they get better, what's going to happen is this leg's going to become slightly longer. And they're going to bring this up to 90 degrees and then back down. Slightly longer. Eventually, when the athlete's able, they'll be able to actually extend the leg, bring this down almost to the ground, and then come back up. You don't need to come any higher than the knee. We're going to keep the leg extended as we're coming up. We're going to come back down. Things we need to watch for while he's doing that is to make sure there's no change in the lordosis, so we're maintaining that posture. And again, they're able to emphasize the abdominal external oblique. Nice and slow for repetitions. Okay, we want a slow, I like to think about a 7-second repetition between up and down. 3 up, hold for 1, and then 3 down. The reason we want to go slow is we want each individual fiber, okay, in our muscle, the actin and myosin fibers, to interdigitate appropriately. Think of it like a sprocket on a bicycle. Okay? We want each portion of the chain to engage with the teeth on that sprocket. If I start going extremely fast, I'm going to skip teeth. It's like losing teeth on the outer chain ring there. Okay? If we're skipping teeth, we're not getting the maximal amount of interaction of actin and myosin in the muscle. If we don't get a maximal interaction of actin and myosin, there's no protein replication that takes place. We lose cross-sectional area of the muscle. And remember, strength is going to be proportional to cross-sectional area. So slow repetition is going to be better than a faster repetition. Then, because we're training specifically for type of exercise versus speed of exercise will slowly increase the rate so they can do it in a consistent manner. If your athlete is performing this exercise and you're seeing a lot of ratcheting, especially in the eccentric phase during lowering, you're working them too hard. We need to back off until they can do concentric and eccentric phases equally smooth.